There's a couple of areas in non-labor expenses that really have to be looked at. We double down a lot on physician preference items because there's so much change in that space, whether it's pricing, new product, or physician utilization. But in purchase services, there's been a lot more focus on that recently in the past few years. However, the approach has been wrong. The whole approach has been, how do we place purchase services in a box and make it easy? Well, I'm here to tell you it's not easy to put purchase services in a box because the line item details, all your spend is on your invoices. So best practices that hospitals need to embrace is you have to go beyond categorization and you have to go beyond oversimplified ratio benchmarking. You need a line item approach. That is a must.
Welcome to the Healthcare Leadership Experience, a place where healthcare leaders will share proven strategies and innovative approaches to leading the clinical and business side of healthcare. This show is sponsored by VIE Healthcare Consulting, who has proudly helped hospitals save over $700 million in non-labor costs since 1999. Here's your host, Lisa Miller, founder and CEO of VIE Healthcare.
Hello, this is Lisa Miller, and I'm the host of the Healthcare Leadership Experience podcast. And today I'm here with my podcast producer and marketing strategist, Lisa Larter, and we're going to change things up for this episode and then our next episode. On this episode, Lisa has requested to interview me on trends and then the following one on predictions in healthcare as a way to wrap up this year and start the following year. So I'm excited, Lisa, to have this time where you get to ask me questions. And we talk today about trends in healthcare. So welcome.
Thanks, Lisa. Thanks for having me. And thanks for saying yes to doing this a little different.
Great. But so before we get started, I have a special announcement about the show. We have been syndicated on the healthcare radio now for the last, I would say, about a month and a half. And starting January 2022, we are going to change from a podcast to a real radio show. Will be aired 3 times per day on Healthcare Radio Now. And I encourage everybody to go over there. They have some phenomenal healthcare radio shows, and we will be on their radio show Monday through Friday, 3 times per week. So I welcome everybody to go over there to listen. We're also on Apple and Spotify and Pandora and all the other platforms. So Lisa, as we jump in on healthcare trends, I want to just give a little context because there were some big winners in 2021, and 2020 and 2021 were challenging. Everybody had to focus on COVID and patients and just this whole environment of how to provide healthcare in a pandemic. But there have been big winners in 2021. And those are hospitals that stay committed to their financial performance improvement goals and their cost savings work streams. They sought to utilize analytics in a deeper way, and they pushed through industry norms and were okay with being uncomfortable. So I work with 2 particular clients, similar in some ways and different in others. One was a small hospital and the other was a mid-sized system. And they both worked through COVID and were able to achieve remarkable results, cost savings results, in the midst of being in a pandemic and in the midst of having to do those things that other hospitals had to do as well. And the small hospital took out $3.2 million in cost savings in 14 months, and the larger one achieved over $10 million in 14 months. That's $3.2 million in 14 months and $10.1 million in 14 months, both during COVID, when the pandemic started and in the worst time for hospitals. So I want to say there were some big winners that decided to stay the course, to keep their initiatives. And those are the hospitals now that have a little bit of cushion as they enter 2022. And we'll talk more about that on today's show. So Lisa, I'll let you take it over now.
Awesome. Thank you. I also just want to acknowledge that we are on episode 28. That is amazing. Like 28 episodes deep, which is just fantastic. So Lisa, you have been working as a strategic advisor and consultant with senior leaders and executives in healthcare for over 2 decades. And I know how passionate you are about the work that you do. You have helped hospitals save 6, 7, and even 8 figures in unnecessary purchase services spend during that time. And I know that you have helped them save in total more than $1 billion in savings. So I'd like to discuss some of the trends that you have seen that healthcare leaders really should pay attention to. So let's start by acknowledging that it takes strong leadership to seek outside help and expertise in any type of industry. So what are the 3 biggest reasons that healthcare leaders seek your help? And just to kind of piggyback on that, why do you think these leaders seek help around these trends that you have identified instead of ignoring them?
That's a great question. And I think probably more than 3, but I'll kind of buzz through them a little quickly. So number 1, they've been benchmarked in some way, shape, or form. And there's different ways that they can look at their peers, and they've come up with some gaps, and they've seen themselves maybe fall a little short. So they want to close that gap, and they need outside expertise. And number 2, they already have a margin gap. So it's already there. They have a deficit, and they need every area looked at. They need to find new areas to optimize. They can't tap those same areas. We have this fatigue around certain areas that keep on getting looked because they're comfortable, and we got to move to the uncomfortable that haven't been looked at. It's interesting. I hear a lot when I speak to healthcare leaders, and they have a hunch something's off. They just kind of a feeling that their contracts need to be reviewed. They haven't been benchmarked, but just something feels off. Or they have this large contract that they're very concerned about. We get a lot of those calls that they just need a review or help with the resetting, the analysis, because it's such a large percentage of their spend. Interestingly enough, we get leaders that also want a buffer with their vendors for negotiations. They know they need to do certain things, but they don't want to be the ones to do it. And it doesn't mean that anyone's bad or not incapable, but it's a smart strategic decision to want to have a buffer. And the hospitals and our clients are involved, but sometimes they're a bit removed in certain aspects.
So you act as that buffer for them.
Yeah, absolutely. And recently, just this past week, we had a hospital say to us that they appreciate the fact that we are the buffer. In some cases, these are services or relationships that the vendors are in every day. And, they appreciate the relationship, but they also know that they need to have better pricing, or they need a better contract, or they need a better structure. And they really appreciate that. So we get lots of feedback on that part of the conversation. And lastly, I think 2 things. Lastly, they have a big strategic goal they have to achieve, right? So they're high performers. And then secondly, they're concerned about the environment. They want to be anticipatory.
So over the last decade, let's say, because you have experience that, expands past that, what are some of the warning signs that you have repeatedly seen that indicate a hospital might have a problem with their spend? And in your experience, who's the first person inside of the organization to notice this warning sign? And are there barriers potentially to getting the message to leaders and decision makers?
It's a great question. So I think the warning signs are expenses by department are higher, they're increasing, their budgets are off. They have performed some kind of deep analytics review of their surgical case profitability, or they're looking at diagnostic test profitability, and they're upside down or thin margins. Those are, I think, those initial warning signs, or they have contracts and vendors that seem to be increasing, or they get vendors asking for amendments for more money. They're hearing from managers that their physicians are making more requests for implants or equipment that are similar. So they have 2 and 3 of the same products and implants. And I think the first people that see this are the VPs of finance, or the directors of finance. And so I think they are the front lines of saying, okay, something's off, because they're in charge of the budgets. They work with the expenses in the department. And, the barriers to maybe why they are not getting these initiatives looked at least quickly until they're maybe a bigger issue, is that there's a reason for it. There's an excuse, there's a reason for that, and everyone's got a reason for it, or we can't do anything about it.
Reasons or rationalizations.
Yeah, reasons are rational. Exactly. It's interesting because a CFO recently said to me, we're not embracing the data. We don't want to ruffle feathers, and we take too much pride and ownership. And I think that CFO sums it up very, very well. Sometimes they don't want to hire an outside firm, or they have an over-reliance on GPOs. And Tony Robbins said, interestingly enough, you either have a strategy problem, which includes an implementation of strategy problem, or a psychology problem. And worse if you have both. So sometimes it's our psychology that gets in the way of high performance because we make all these excuses.
Yeah, that's really well said. Really, really well said.
So if you're just tuning in, you're listening to the Healthcare Leadership Experience on Healthcare Radio Now. I'm your host, Lisa Miller. Today I'm joined with Lisa Larter, my producer, and we're talking about trends in healthcare in 2021, and specifically what has worked for hospitals and what has been some of their challenges. The show is sponsored by VIE Healthcare Consulting, the leader, advisory, and analytics firm helping hospitals accelerate their margin improvement goals. VIE has collaborated with healthcare leaders and their teams to accelerate their strategic initiatives and improve their financial performance by over $1 billion since 1999. So Lisa, you were asking me some questions today and letting you continue the discussion.
Yeah, I love everything that you have had to say. I think that it's super, super, super interesting to hear some of the trends that you have observed in healthcare. And especially, I love what you just said about Tony Robbins, and you either have a strategy problem, which includes implementation, or a psychology problem. And it's even worse if you have both, because I think that there's probably a lot of that goes on. So I want to know, what is one cost savings planning trend that hospitals really need to embrace from your perspective? On the entrepreneurial side, I could probably give you a dozen things that people need to do when it comes to planning. So I'm really curious to hear your perspective on this in healthcare.
Right. So I've been doing a lot of thinking about that this past year. And, we have an approach called the 1080. And the 1080 is really around taking a complete top to bottom review. That's from your highest dollar expense all the way to that $1, which never gets done, right? A complete review of every single dollar spent and looking at it in 360 views. That's the contracts, that includes pricing, the utilization, which is key, and then the awareness. So it's really important, as we take a step back, you've got to have a big, big goal, financial goal, cost savings goal. It actually scares you. I actually had one of those for one of our clients in 2020 and 2021. We were able to achieve it, but it scared me. And I since talked to the CFO about that. And she has actually said, we probably need to have another scary goal, and I agree with her. But in this review of $1 to, your highest dollar expense, the pricing needs to be looked at, the contracts need to be looked at, the utilization, and how we engage physicians in a meaningful way, not when we're going to ask them something, but way before. It's interesting, when physicians own their surgical centers, their costs for implants are probably the most competitive, but yet in the same hospital, those costs are not as competitive. So we know physicians are such an important part. They can drive costs down, but we have to engage them in a real meaningful way and early on. And I also think that there are two things that we don't talk enough about, is measuring and monitoring, and how that's done in a deliberate way every month, and cost awareness. And, I've spoken in past episodes about cost awareness, but it needs to be, cost aware for patient care, from physicians through frontline employees.
Yeah, that's so important. Lack of awareness can just cause so many problems, not only inside of organizations, but even in life, right? When you know better, you do better. So tell me, Lisa, what are a couple of the, let's say, best practices that you've seen some of your best clients in healthcare embrace repeatedly to get the best results from their hospital purchase services spend? There's got to be some trends related to best practices, things that they do that other hospitals or healthcare leaders don't do.
Yeah. So just to take a step back, there's a couple of areas in non-labor expenses that really have to be looked at. We double down a lot on physician preference items because there's so much change in that space, and whether it's pricing, new product, or physician utilization. But in purchase services, there's been a lot more focus on that recently in the past few years. However, the approach has been wrong, because the whole approach has been, how do we place purchase services in a box and make it easy? Well, I'm here to tell you it's not easy to put purchase services in a box, because the line item details, all your spend is on your invoices. So best practices that customers or hospitals need to embrace is you have to go beyond categorization, and you have to go beyond oversimplified ratio benchmarking. Can't benchmark your purchase services spend, a particular spend like EVS to bed size, and compare to a small hospital to a big hospital. You're going to miss out on opportunities. You're going to frustrate your supply chain team. It just can't be done. So while starting with the categorization is definitely directive, and that's a beginning approach, you need a line item approach. You need a spend map, a 12-month historical data approach. That is a must. For large health systems, there's different approaches around analytics across all hospitals. What can you do, let's say, for biomed or for reference lab or for regulated medical waste, to look at how each hospital is performing, what they're doing in the specific hospitals, how you can get, insights, how you can consolidate, how you can manage hospitals across. There are specific system-wide measurement and monitoring systems that need to be put in place, not just KPIs, but real measuring of spend, focused on critical drivers. And, I think that approach is key, because, we tend to want to put purchase services in a dashboard. We always, it makes it easy to sell things, right? And the reality is purchase services is a roll up your sleeves, digging into the invoices, digging into 12 months of invoices. That could be thousands of pages. And the fact is, it can be done. We do that, but that approach has to be a line item approach. And I'll tell you, our clients are getting dramatically different results than those that are using categorization, simplified ratio benchmarking, online RFPs. Our clients are getting 2, 3, 4 times the results because they're taking a line item approach.
That's great. It's so important to, really have a plan, and to have, historical data, and to be looking at those line items, and to have really clearly defined KPIs. I think those are best practices for so many organizations. So tell me, this is my final question for you. What is one trend that you've seen that healthcare executives are not aware of? It's like one of those things where you tell them and they're like, well, I didn't know that they really should be aware of.
Oh, wow. That's a tough question.
And I don't mean it to make executives look bad, but we're talking about trends here. So my assumption is you've seen a few things where you assume that they know, and they don't, and they're glad once they know. But what is the one thing that they don't know, but they should know?
Right. I think that there's a pattern that I've seen, and we talk a lot about, and I don't know if it's that they don't know as much as that they need to be reminded, or maybe we've gone so far down this road that maybe it isn't, I don't know, but it's the power of self-contracting. Hospitals have such power or such the abilities to self-contract, but I think that in the advent of GPOs 20 plus years ago, they were meant to come in and use as an aggregate to help get better pricing, hence why they got the safe harbor protection, because they are paid by the vendors. And there's definitely value in those areas where a GPO can aggregate volume. However, there is a large spend, probably more so than not, that the hospitals should be self-contracting. And we've got to go back to that self-contracting strategy. GPO pricing may not always be the best pricing. And in fact, when it comes to some of those PPIs, physician preference items, high cost supplies, and purchase services, the hospitals will do better self-contracting. And there is a role for GPOs, but we also have to remember the funding source. And the funding source is the vendors pay the GPOs. So self-contracting is such a powerful tool that the hospitals need to be pushing more and more of their spend towards self-contracting. And by doing that, you'll have second and third order consequences, which is they'll be able to be self-reliant, they'll be able to self-manage and do a lot of things that they don't do now because they assume that the GPO is handling it. And I think that's the thing that really is the missed opportunity, is just really thinking, the GPO's got it. We got it covered. We have a high compliance rate with the GPO. So
stop assuming and instead start inspecting what you expect.
Yeah, definitely stop assuming, right? It's really just taking back control, Lisa. Expenses and costs are going to be a bigger part of hospitals rebounding and closing gaps. They just are. And, we've got to go back to self-contract. We've got to go back to looking at even those outsourced physician services agreement. Those are like outsourced, anesthesiologist services or ER services. And looking at those agreements annually, actually, they're required for compliance to review annually. And by doing that, it's a nice way to put in your systems other agreements that need to be looked at annually, not just when the contract is coming due. And we have a habit of waiting for a contract renewal to do all that work. And it really should be an annual process of review.
And I've heard you say before that a lot of executives when you tell them about the technology that you have that allows them to get to line item details so they can have greater insights on what's happening, that they don't even realize that this technology is available. Is that true?
It is true. I have continued to have weekly calls with healthcare leaders, and I explain what we're doing. And we've taken an off-the-shelf OCR tool and we've customized it, and it's patented to be able to extract the invoice line item details in a structured way and perform analytics. And when we show our hospitals how quickly, within minutes, we can extract and analyze, they're shocked. I know it's unfortunate that, more hospitals, aren't aware. They think, well, this is just the way it is. But we're providing some of our clients with unparalleled, amazing insights, because we're getting 12, 18 months of historical line item details for some of their most complex purchase services spend. We're getting them turned around so quickly with insights, benchmarking, and a strategy for them to have the best contract for their hospital.
That's great, Lisa. So in summary, what I would say is don't assume that technology hasn't advanced with what your ever-changing needs are in healthcare, because there are lots of advances. Thanks so much for having this conversation. I'm going to hand it back over to you to wrap up.
Thank you, Lisa. I appreciate the questions. They say that questions are the answers. Good questions lead us to the best answers. So I appreciate the questions today. Thank everyone for listening to the Healthcare Leadership Experience today. Our previous show, episode 27, was Why Your Hospital Needs a Podcast. And, Lisa and I have both have podcasts, but we really kind of dive in deep about your hospital having your own podcast. So I love podcasting because it allows me to share a lot of what we're seeing day to day to a bigger audience and just helping more hospitals and leaders and teams, achieve their goals. Our next episode is episode 29 on our 2022 predictions. Email me and let me know what you'd like to see for us to cover in 2022 on the show. And if you aren't connected with me on LinkedIn, please connect. I'd love to share the year with you on LinkedIn. I wish everybody a Merry Christmas, Happy Holidays, and thank you for your support of the Healthcare Leadership Experience. We'll talk soon.
Hi, this is Leah. You are listening to my mom's podcast, The Healthcare Leadership Experience.
Hi, this is Fernando. If you would like to speak with my mom, just email her.